Okay, this is Screencast number 6, Lipid Health Claims, and it is based on an application which I'll read out in a second, and it is also slide 85 and 86 on the PowerPoint. The application reads, evaluation of evidence and the methods used to obtain the evidence for health claims made about lipids. So what this is your health claims, it's your evidence supporting those health claims with a counter to the support. So it's a good idea if you read about this in your textbook so you understand what I'm going to be discussing, because it's not a lot of notes and a little bit more discussion here. So here are the two evidences. There are two main claims made about lipids in the diet. Number one, which we've talked about, diets rich in saturated fats and trans fats increase the risk of coronary heart disease, and diets rich in cis fats, monounsaturated, polyunsaturated, decrease the risks. So there are your evidences, there are your health claims. What's the evidence to back those up, and what is it based on? Okay, so these health claims are made on evidence collected in these three ways. Number one, epidemiological studies of different populations. And epidemiological is the fancy smancy term for the branch of science that now does those kinds of tests, those studies there. Studies that follow groups who modify their diets, and experiments on lab animals and autopsies on people who have died. So those are the three evidences here. And so if we go over the evidence supporting using epidemiological modified diets and experiments, there's a counter to that. Well, as in, well, positive correlation, but. So for instance, the meat industry, especially the red meat industry, the beef industry, might have counters too. So let's go over one. Let's see, the epidemiological first here says, well, there is a positive correlation found between the intake of saturated fat and incidence of coronary heart disease in human population. Well, what's the counter to that? Well, there are certain populations on this planet who don't fit the trend. For instance, there is a tribe, the Maasai tribe in Africa, that has a very fat-rich diet, but very low instances of coronary heart disease. All right, it's the intervention. So if you look at the following groups who modify their diets, well, what's the counterclaim to that? Well, it's dependent on certain things and the validity of it. It's dependent on size, dependent on who is the people doing it, women, men, old, young, as well as how long studies were for. So counterclaim to it. And experiments on lab animals and autopsies. The only thing I can really bring in here is taking a look at genetics these days, because if you're experimenting autopsies on the dead and they're higher in blood cholesterol levels, that is what it is. But genetic factors may play just as big a role, because blood cholesterol level is being found out really only shows a very weak association to dietary levels. Okay, how about diets rich in cis fats, which reduce? So what's the counter to that? Well, increased carbohydrate intake may be just as detrimental and associated with coronary heart disease as fat intake. Diabetes, obesity caused by higher carbohydrate levels can also lead to coronary heart disease. Another counter, incidences of coronary heart disease dependent on factors, again, as we just said before, besides dietary intake, such as do you exercise? Do you have access to health care, affordable health care? So in the end here, we do have health claims and evidences to counter. So read about a few of those in your book, or replay these and jot a few of those down that you can speak to. So to sum things up here, you see comparison of the main types. All right, your unsaturated fat to the left, your saturated fat and your trans fat. All right, unsaturated fat raises HDL and therefore lowers LDL. Saturated fats raise LDL. Trans fats really raise LDL. Bad, 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 bad.